In the lecture, I would like to go into this topic intermuscular spaces. All of these muscles that we discussed till now, excluding biceps and tricep, the particular arrangement of these muscles leaves some gaps between them. So these are the few spaces that are created between them. So here, this is the quadrangular space, and it is created by subscapularis in front and above, and behind it above there is teres minor too. On the lateral aspect there is humerus. On the medial aspect there is long head of triceps. On the inferior aspect there is upper border of teres major. So this is the quadrangular space. It contains axillary nerve and posterior circumflex branch of posterior circumflex humeral artery and vein. I will show you in the model too. Then there is this space, upper triangular space. It is created by superiorly through the subscapularis and teres minor, inferiorly by teres major, and medially by long head of triceps. It contains circumflex scapular artery. Then there is this. There is inferior triangular space. It is created by teres major above, shaft of humerus laterally, and this long head of triceps medially, and from that the structure is going to the posterior compartment of arm, that is the radial nerve and profunda brachii vessels. Those are passing through. So these are the structures that are visible right here too. And let me go through the 3D model. So between this whole area, this is the quadrangular space, and it is present beneath the scapula. I've added the subscapular muscle here. So anteriorly subscapular muscle, posteriorly teres minor. So don't be confused, because in different books you will see teres minor or subscapular is alternatively mentioned as the superior border, teres major as inferior border, this triceps as lateral border, and this humerus as the triceps as medial border and humerus as the lateral border. And passing through them are this artery, that is the posterior circumflex humeral artery, and this nerve, that is the axillary nerve, that is going to supply the deltoid and the skin over the deltoid, and teres minor muscle too. Now there is this triangular space, this small one, this area uh, covered by long head of triceps laterally, subscapularis or teres minor superiorly, and teres major inferiorly. And here is the axillary artery, its branch, subscapular artery, its branch, circumflex scapular artery. So this is the only structure that passes through, its circumflex branch of scapular artery on the way to go to the infra spinous fossa. And last but not the least, this triangular space, this is the lower triangular space covered by teres major and latissimus dorsi, to be more honest, above, and humerus on the lateral aspect, and triceps long head on the medial aspect. And from them there is these arteries and veins going to the back of the arm, that is the radial nerve, and this is the profunda brachii artery on the way to the back of the arm. So these are the structures that were making the spaces. These are the pictures from Netter to go through if you want to. I think we have discussed the clinicals along it, and these may be important. These may become important when these structures are damaged. For example, this quadrangular space is at the risk of injury when there is a fracture of the surgical neck of humerus, or when then there is downward dislocation of the shoulder joint. So axillary nerve and posterior circumflex humeral arteries may be damaged. And in Saturday night palsy, we will discuss in the brachial plexus, the lower triangular space, the radial nerve and profunda brachii may be compromised. Quiz, very simple quiz. Just pause the video here and try to figure out these muscles. These are pictures from Gray's Anatomy flashcards. Pause the video at different parts and try to figure out all of these muscles. I think apart from bicep, tricep and coracobrachialis, I have discussed all of the other muscles in quite extensive detail. Thank you so much for listening. I hope so this had been helpful for you. If you have any questions or feedback or suggestions regarding this lecture, please mention down in the comment, and you may reach us through our website. By the way, all the recordings with presentation material is present there, and our Facebook and YouTube channel. Please feel free to reach out. If you have any queries and suggestions, please let me know. I will be trying to follow up with further lectures on the upper limb. Thank you so much.